Hi, I'm Dr. John McAllister. I'm going to discuss total hip arthroplasty. Everything that you see today is also available on St. Peter's Bone and Joint website. Total hip arthroplasty is an operation that was popularized by Sir John Charnley, I believe in the 50s. It's been around a long time. Some of the things that we've done to modernize the operation are improving the parts that we implant and making the surgery less invasive than it used to be. But it's still a hip replacement, and I never liked the notion of a minimally invasive joint replacement. It's very invasive. Hip replacements are typically done when the ball and socket are just worn out. There's a lot of friction, usually stiffness, pain. People usually have groin pain. It's very uncomfortable, makes walking difficult, usually a limp. And assuming we've tried other things and you failed conservative care and you say, I can't do the things I want to do anymore because my hip hurts too bad, then now it's time to discuss hip replacement. So a hip arthroplasty involves removing the ball of the hip. We do an incision that's usually about this big.
To begin, the surgeon will make an incision to access the joint. The hip joint is then opened to allow the surgeon to remove the damaged bone and cartilage. The head of the thigh bone is removed, which allows the surgeon to see the hip socket. Damaged cartilage and bone is removed from the socket. The implant is placed and may or may not be secured with surgical screws. The second implant is placed into the thigh bone and may or may not be secured with surgical cement. The artificial ball of the hip is then secured on top of the implant. The wound is then closed and a sterile dressing is applied.
We actually split some muscle fibers, but we don't actually have to cut muscle. The hip is taken out of the socket, we remove the ball, and then we're looking at the socket part of the hip, and I replace that with this type of device. This is a metal titanium component. It looks a little scary with these little spikes, but that just basically helps to hold it in the bone initially, and the bone will actually grow into this rough surface. Then it has a plastic liner that snaps in, and once you hit this, it locks into place. This is made of a high molecular weight polyethylene that's been cross-linked, and now these hip replacements, because of this change in plastic, may be able to last 30 or 40 years, whereas the old hip replacements would often begin to wear out by about 15 years. There's a stem that goes down inside the femur, down the hollow part of the bone, and these come in all different sizes, and so do the sockets. They go up every 2 millimeters in size, so we can get the size that fits very nicely and very tight. It goes down inside the bone and locks in, and the bone will grow into this titanium and bond to it to make this a firm, tight fit. There's a ball that fits onto the stem, and this is made of a ceramic. They're different sizes, and it depends on how big the socket is. We like to have a large ball because it's generally more stable, but we have to put it in according to how big the socket is and how big the patient is. So the ball then fits into the socket, so when you walk, all the movements occurring between the ceramic and the plastic here, there's no nerves in ceramic or plastic, so it can, then that's what gets rid of the pain. Basically, you can walk without pain, and it allows for good range of motion as well. We hope these hips will last 30 or 40 years. There are some risks of hip replacement. There's a risk that because of how we put it in, basically we're putting the socket in, then the stem in, and then the last thing I do is I put the ball into the socket and sew some things up. So I have you avoid bending too far. About 90 degrees of flexion is what we try to ask you not to exceed, and not cross your legs. And what that does is allows the tissue that I've repaired to heal, so that the ball will then stay in the socket. The other risk, obviously, with any joint replacement is infection. I'm always worried about that. We do our very best to prevent infection. We use antibiotics. We use spacesuits. Our infection rate is about 1 in 150 cases. If it happens to you, it's a mess. I'll help you with it, and neither of us will be happy about it. There's a risk of getting a blood clot after surgery, so we use a blood thinner typically for about 6 weeks. And there's different options that we can utilize there. There's also a chance of needing a blood transfusion, but I think the odds of that in my hands are probably about perhaps 1 in 20, so it's not very likely that you need any blood. I can change the leg length a little bit when I put a hip replacement in. I do my very best to put it back where it's supposed to be. I also have to make sure that the hip's stable, so sometimes a little bit of a compromise is made there. I think those are the main things, and then if you can keep the ball in the socket for 3 months, it's very unlikely it'll ever come out. If we don't have an infection, which is most people don't have to deal with, and we'll do our best to prevent that, then you should have a hip replacement that you can do normal things on, walk, hike, maybe play doubles tennis, certainly play golf, but basically get around without pain very rapidly. A lot of people by 1 month are very, very happy they have a hip replacement. The typical stay in the hospital is 2 or 3 nights. It's not at all unusual for people to have surgery on Monday and go home on Wednesday after a hip replacement. We get you up walking right away. You can put all your weight on it from the first day. They teach you the restrictions about what to do and not do. When you do go home, you'll have a therapist that'll come to your house and a nurse that'll check up on you at home. There's not a lot of exercises you have to do. Basically, you have some restrictions, and then walking is your best exercise. By about 4 weeks, I see you back in the office and we get an x-ray. If everything looks okay, we start talking about, okay, what can you do now at a month, and then at 3 months, you can really resume normal activities. I never really encourage people to run on a total joint. It's okay to do it if you have to hurry across the street or a bad guy's chasing you, but it's not really made to run on and jump on, but it will do that. But it's basically for normal motion, normal activities, and low impact type of activities and exercise. We do typically get x-rays periodically after surgery. I recommend an x-ray at about a year and another one at about every 5 years to look for wear changes. If the plastic begins to wear out, it can cause problems with the joint, and we look for those problems on the x-rays. So when you're in the office, we can go over your specific case, whether you're a good candidate for joint replacement, and answer any of your questions.